Dorian, why don't you go ahead and just kind of share with our audience who you are?
My name is Dorian Reid. I'm an orthopedic surgeon with a specialty in foot and ankle surgery at Kaiser Permanente, Washington. I work out of Tacoma, Washington, principally. Um, I've been living in this area for about 7 years now and really enjoy it. Love the outdoors. My family loves it. So it's been a really good experience being here and working for Kaiser. I just briefly about kind of my mark. So with my training and I've lived in literally every part of the country. I'm originally from New York City, and I left there probably when I was around 10 years old, and then moved down to Virginia and did high school, middle school there, and then went to college in Boston. I then did a couple of years of a break, so I'm kind of a non-traditional doctor in that I took a few years off in between college and medical school. I moved to Los Angeles. I worked in film finance for 2 years, and then went to medical school. And then after medical school, 5 years of residency for orthopedics, and then a year of fellowship. So it's been a long journey. Like I said, I've been working at Kaiser for about 7 years now, um, and it's been great.
Well, that's wonderful. I think we have a little tie to each other in that I actually went to college in Virginia myself,
Oh,
but
cool.
yeah, I went to Hampton University. So a little bit about me
Yeah.
is that I've been with Kaiser Permanente for 4 years. This will be, I guess, 4.5 years at this point, all on the administrative side. So a little bit different, of course, than being a clinical healthcare professional. But I was born and raised in Portland, Oregon, and was really adamant about going to a historically Black college. And so all of those were back east and down south. And so I chose Hampton University, studied journalism and communications with an emphasis in advertising, and really wanted to be in media sales. So my goal was to broker relationships between clients and advertising companies to be able to get that right, message out to clients. And some things happened with my family that caused me to move back home to Portland after school, and I kind of fell into like some administrative roles and started working in spaces that allowed me to be able to help people figure out what their next steps were going to be. So I ended up at a career college that was focused on medical assisting and pharmacy, tech and other kind of more entry level healthcare roles, and really loved being able to help people transition from study to career, for them to be able to get to that professional level. And had the opportunity to start at Kaiser Permanente with their pipeline programming. So in the Northwest region, they've got a really strong pipeline program department that works on their internships and their fellowships, and I got to lead the high school program to be able to help low income marginalized high school students learn more and explore their interest in healthcare careers. So I did that for a couple years, and then had a really unique opportunity to come to the Washington region to be able to work on the talent management and culture team, which is where I am now, where I get to teach our managers and our leaders how to build and foster psychological safety for employees, and help our employees to clear and carve out a path for themselves for their career, because we really want Kaiser Permanente to be a career destination for our employees. And so that's the work that I do now, which is really rewarding. And so I'm really excited to have this conversation with you today about, what is it like to be able to help people, figure out, or what was really, the process that you went through to really be able to figure out that being, a healthcare professional on the clinical side, really, but, to be a healthcare professional was the thing for you. So if it's okay with you, I'd love to, kind of just ask a few questions of you. I love that you had mentioned that you had, this time, and, I think it was film finance that you had mentioned. That sounds really cool. Like, how did you transition? What can you take us a little bit through through the, like your thought process about what, got you to turn that corner for you to really say, you know what, I think I want to be a healthcare professional and I'm going to spend my time doing that.
So that's a great question, and thank you for kind of sharing your journey because I think that it's really, the administrative side of healthcare is obviously super critical in the work you're doing and kind of helping us, in developing our own careers. And so I thank you very much for doing that. I will say that the decision, all the decisions that I've made along this journey to becoming a healthcare professional have been in some way sort of selfishly motivated. So, going into film finance for a few years was really, it was something that interests me. It was sort of a fortuitous, I didn't intentionally move to LA with that plan in mind. I sort of knew some people. I met some people there that became friends, and it was just sort of I was at the right place at the right time. I had a friend who I sort of became pretty close to, who was a director, and so he was like, "Well, this company." He was friends with a guy who worked for a film financing company, and they had an opening, and so I was just like, "Okay, well, this is new, and I don't really have a background in this per se, but I can learn to do the work." And it was fairly, my role was fairly simple. I was really more collecting scripts and helping read scripts and figure out whether they were something that the company actually wanted to put money into, and setting up meetings with different people and sort of being in on those decisions. So that was kind of cool. But it was really totally just I was interested in it. So that's kind of how I ended up there.
That's amazing. Now, of course, I have to ask before we get back, is there any film that we might all happen to know about that you actually did get a chance to read a script for?
Yeah, yeah, yeah. So there was it's a pretty old movie because this was back in, what was this, like 2012, 2011, something like that. And so The House of Sand and Fog, which was a Ben Kingsley movie, and I think it actually got nominated for some awards. Um, I actually had a chance to read the scripts for that, and then like there were a couple of smaller movies that the company sort of was considering while I was there, and I got to read some of the scripts and be in on some fun meetings, sort of figuring out whether it was something that they wanted to invest in.
Well, thank you for
So
humoring us for that,
yeah,
because
yeah.
I know I'm not the only one who had that question. So love that. But tell us more about, the selfish motivate. I love that you're like so open with saying it was a selfish motivation. Like, tell me a little bit more about that, about kind of where you were, trying to make these decisions for yourself.
So I did know for a long time that I was ultimately going to go to medical school. When I made the decision to move to California and to do, to work in an alternative industry and do something very different, I still was studying for my MCAT. I was still preparing for medical school during that time. So I wasn't taking a complete step away from the path. And that started for me in high school. So it was something that I had always had in the back of my mind and I was still pursuing, but I wanted to do something fun, in the interim because I knew that it was going to be a long journey and it was going to be difficult. And the same is true for, my decisions for studying in college. I studied anthropology not because it was preparing me for medicine, but because I was interested in it. And I think that's a piece of advice that I give a lot of students is that, if you're going to be a nurse, a dentist, a doctor, PA, whatever your path is going to be, um, that path is pretty scripted. And so feel free to pursue your interest off of that path. It doesn't mean that you won't ultimately get to, being that professional, that healthcare professional that you ultimately want to be. But it's such a long journey that you should have fun along that path. And so that's what I did. That's why I say it was selfish.
Yeah. I love that. I love that. Now, as we think about, making these decisions to figure out like, what discipline am I going to ultimately pursue? I think many, folks kind of grow up saying, I want to be a doctor, but then there's so many disciplines. I mean, so many things that you can do. What are some of the questions that one needs to ask themselves when they're thinking about pursuing first, a career in healthcare, but then when we get down to discipline, like what are some of those things that you might have asked yourself or that you would advise that people should be thinking about as they're looking to make their decisions?
Well, you might commiserate with this, and I think many people who are deciding to go down a long path and a long journey for their career or otherwise will ask this question. And I think the biggest question is, why are you doing it? What's motivating you? What's driving you to do this? Um, and it really has to be almost a decision you make. I mean, somewhat you have to consider factors that are outside of yourself, like, is this something I could do because I may potentially accrue a lot of debt and I don't necessarily want to accept that sort of debt? Or do I really want to work the kind of long hours or the lifestyle of that particular specialty or profession? Um, those are the kinds of things that you have to think about as well. And those are sort of external factors that you can't necessarily control. But I do think that really thinking deeply about self, and I sometimes will tell students, like, the way I think of it is it's like a you can almost think about how you make really, really important decisions. And for me, it's making lists. And for me, that's meditative. So my soul searching often when I'm trying to make a decision looks like me making a lot of lists. Like literally, I open up a Word document and I put pros and cons. And then I say, okay, what are the pros of me doing this particular thing? The pros of being a physician are, you get to help people. You have a nice income, which is okay to say. Or um, get to, it could be something simple like you get to move to different places in order to do your training. You get to learn, constantly learning something for your whole career. Cons could be the long hours, the debt, the sacrifice of your time. Trying to get a work-life balance can be difficult. So those are the types of meditative exercises that I think are helpful. And it's not a decision that's made after one. It's really it's a continuation. It's a process, and it could take months or even years to make that decision.
Wow, I love that. Just the idea of really being able to take time to like put pen to paper or, fingers to, to keys, I guess, to be able to, write down like, those pros and those cons. I think that's wonderful. Now, you had mentioned before that, yes, like, selfishly, that it's like, this is what I decided that I wanted to do. But I also know that it's important to think about, having people around, whether it be advisors or family or friends, to be able to, help support or guide. Can you talk a little bit about, those that you've kept kind of on your team to be, helpful to you as you were making those decisions? And how much would you say that their, opinions or their support, really meant to you while you were making decisions to start your career in medicine?
Yeah, so I think the people, the cheerleaders, the people who are in your corner are really critical um, in any difficult path. And so, for me, particularly in the beginning, it was my grandmother and grandfather, and they were always champions for education, and they really pushed me. And then I sort of had a difficult time when they passed, trying to. Um, basically have someone else consistently in my corner. My parents were kind of peripherally there, but they really, to be honest, were not super rah-rah supportive of my path of medicine. They thought it was going to be really too difficult and that, it was going to be too stressful. And so I kind of accrued people along the way. I met people in college, for example, who I'm still really good friends with, who were either on a similar path or they were, getting their PhD and they could kind of relate, or they were in a completely different field, but they were really great in those middle of the night pep talks, or I'm texting furiously because I'm stressed out about some application thing that I'm not sure how to proceed with. And so that is really critical, I think, for anyone going on a journey like this.
Thank you so much. I love, like I really just wrote down and underlined accrue people, right? Like you have to think about the fact that, as you had mentioned, your grandparents were great supporters of you along this process. And, unfortunately they passed, while you were, kind of in pursuit. And, we have friends who, move away, or we have, relationships that, that are no longer. So having just one person always be that person for you. Like, what do we do when they're no longer there? So that idea of accruing people, and I like to call it a board of directors, right? That I have people that I move into these positions, in my life to be able to help me make decisions, or that I can go to for counsel or support, because it's so important. And we've talked before about the fact that we have to remember that, other people are also going through things too. They're also, like you said, studying for their exams and doing their work. So if we just only have one person, then what are we going to do when they're not available or no longer there? So I love you saying accrue people. That's so great. Now, as we think about accruing things, we also have to accrue like knowledge along the way, right? Like there are, classes that we need to take, and volunteering, hours that we need to get. Any advice about being thoughtful or strategic about accruing or doing those classes, or getting those hours that you want to mention?
Sure. Um, yeah, Brianna, I think this is one of those things that's sort of universal to any field. And every field, whether you want to be an attorney, whether you're going to be a teacher, or whatever that field is, healthcare is really no different in that you really have to. If it's a career that has a kind of almost set path, you have to be thinking throughout the journey, what experiences do I need? What classes do I need? So, at the level of even at high school, what kind of shadowing experience could you do in order to help make the decision for you, or to just give you exposure to dentistry, or veterinary medicine, or whatever it is. And then most people, as they're going on the level of college, most of the healthcare fields are going to require some level of college. And so that's usually that transition from high school to college where you really start to solidify, what classes, what prerequisites do I need in the form of tests or classes to get me there. And being as detailed as possible is important. So again, I'm a list maker. I'm constantly making lists and going back to those lists and editing and changing and deleting things when they get done. So that's important, actually, to keep a timeline and to keep lists, especially if you're pursuing a course of study and into a profession that requires certain testing, standardized testing, certain classes, by when, needing to know when am I supposed to take that class by, when do I have to take that test by. So timelines and lists are important, and it makes it less stressful to me because you kind of see the broad picture, and you can see like, okay, I don't need to necessarily focus on this stuff that's happening 2 years from now, right now, but I do need to focus on studying for my GRE, which is going to be in, 4 months or whatever that is.
Yeah, that's great. I love that idea of being able to, like, I don't know how else to say it, to like kind of section out or measure out. Like, yes, this is a long process. If I'm looking like today, I'm still, at the beginning of my collegiate experience. And, 12 years from now, I want to be, in this particular role. But the idea of being able to say, what do I need to do, this year, in the next 6 months, the next 3 months, the next month, what does that mean that I need to do this week or even today to be able to make sure that I get there? That's such a good point. Now, as we continue talking about this being like a long journey and things, getting difficult, do you mind sharing a little bit about some of the things that help to ground you along the way so that even when, it's like, oh, I missed that event, or, my friends who are, in liberal arts majors or whatever have the chance to go out and have a good time, or, my friends who are now, parents, and I, waited a little bit longer to have my children because I was in school or because I was pursuing this career. What kept you grounded during your process that you did not faint while you were going through all of your experiences?
That's that's so funny because so it's funny that you're asking that because I still struggle with that. And it is a struggle because you are absolutely right. It's such a long path for some of these things that you do sometimes. I used to compare myself when I was still in medical school. I had friends who were on their second home. They were in finance and they were investment bankers and they had already like bought their home in Maui and we're like chilling and and I'm struggling in medical school. So it's like constantly having to put things in perspective. And that's important, the ability to be able to put things in perspective, and look at the long, you're in it for the long haul. So yes, it's hard. And when people start families and I didn't start my family until recently. I'm 40 now, and I had my first kid at 37, and my second kid at almost 40.
Mhm.
And so, again, a lot of my friends who are in different fields have already, they've been married for longer, they've had their kids are way older. Um, and so it's just really, I think perspective is important. And again, that's where having the people around you to kind of keep you grounded. Having hobbies, and this is more of a stress relief thing, but having hobbies that kind of take you away from stressing about those kinds of things is important too. Um, because I think it can become overwhelming if you're constantly comparing, where your friends are to where you are right now at this particular point in time. So,
Yeah,
yeah.
I love that. And we know that, comparison is the thief of joy, right? Like it's not really
Right.
fair. It's not fair to yourself to say like, "Hey, I just passed this really big exam. I'm super excited." Yes, you just had a child, or yes, you just bought a home. Congratulations, but my joy is mine for, the life that I'm living and for the choices that I've made. And I'm proud of myself. And so I really hear you saying that. It's like putting things in perspective to be able to say it's like I'm still doing well for myself. I'm running my race. These are the choices that I've made. I'm excited about them, which is really, really great. And also, it sounds like if we've got friends who have already had children, that we've got some built-in babysitters, right? That
Right.
we stay close enough that when I've got my kiddos later, that your kids are already old enough to be able to watch mine. So thank you for that, friends. No.
Exactly. Well, and
I've already
also
got that house to
too.
go to, right? To be able to vacation, after I celebrate my, my big exam, or, passing, whatever thing I needed to. So that's exciting.
Well,
That's
if you have built-in advice, we talk about advice. There you go. You have people that you're close to have already been through this, a few years ago, and they're like, "Oh yeah, it's normal for your 3-year-old to try to escape the house and run around outside." So
Oh, I love that. Oh, yes, and I do. My son's 12 now. I do sure remember those days when it's like, where are you going? Like grabbing the bag like you're leaving the house without me. It's like, what are you doing, little friend? So definitely understand. That's so great. Now, I want to, of course, what I enjoy and something that we do at Kaiser Permanente a lot is we talk about patient stories, right? Like we start a meeting with a patient story, or we end a meeting with a patient story to really remind us all. And I enjoy it from an administrative perspective because the work that I do impacts the people that support our members and our patients, but I don't get that face-to-face member contact or that patient support. So I want to just ask you, is there, as you think about your career, you think about, just the lives that you've touched and the work that you've gotten to do over the years, is there a patient story that stands out for you that really helps you to say, wow, I'm so glad that this is the experience that I've had and this is the decision that I made for my career?
Yeah, it's funny. My practice at this point is really mostly foot and ankle, and I have a lot of patients who have been hurting for a long time and kind of have gotten to the point of feeling hopeless. Um, and I vividly remember a story, and this is going to sound like it's not a win, but stick with me. It really is. So I had a patient who I've still seen her actually recently. She had a really, really bad fracture. She basically had a compound fracture of her ankle years ago and had been in chronic pain. I mean, I want to say at least 15 years of just chronic pain, wasn't able to do anything because of pain. She was basically in my office in tears telling me about it. And I was sort of, I'm not one of those people that's like hardened, so when someone is in my office talking to me about their pain, I I like can feel it. Like I'm extremely empathetic and I'm like feeling myself tearing up as she's telling me this story about what she's been going through. And essentially what had happened is she developed bone, basically we call avascular necrosis, which is the bone of her talus and in her ankle just completely basically didn't have any blood supply and collapsed. And so she had severe arthritis and it was basically not functional. And so we had had a long series of conversations over time about what to do. She had tried braces and all different kinds of non-operative things. And we had talked about, well, we could do an ankle replacement, we could fuse your ankle. And she came up with this idea. She was like, what if you just got rid of the leg? What if you just took the foot and ankle and I got a prosthesis? And I immediately balked because, my goal is always to restore function. And as orthopedic surgeons, we consider it a failure to have to take somebody's limb. Um, but she said, I've really been thinking about this for several months that we've been talking. And ultimately, the recovery from a fusion or replacement, which might not even work, doesn't sound like it's acceptable to me. It was like blew my mind that she had had that much. She just kinda said, "I just wanna get back on my feet. I just wanna get up, I wanna move. It's been years of me being debilitated." And, she convinced me that it was the right thing for her. And so I did. I did a, below knee amputation, so I took her foot and ankle. She healed up beautifully, got her into a prosthesis, and I just saw her actually about 2 months ago, and she's in her prosthesis hiking. She's doing great. And I had a long conversation with her and I told her, you had to convince me to do this surgery because it was against everything that I'm trained to do, which is to restore function. And she said to me, you did restore my function. I'm up and I'm moving and I'm walking, and I hadn't done that in like almost 2 decades. So I don't know. It just like it gives me goosebumps like every time I think about that conversation. And that's why I said just it's not what we normally do, but it's like making that decision with her and seeing the result of that was one of the most beautiful stories that I've had since I've been in practice.
That is amazing. And that gave me goosebumps as well. Like to say, like, you did restore my function. We had two different ideas about how we can do it, but isn't it amazing how we are able to listen to our patients and to be able to say, I'm the professional, like, I know what I'm doing, right? But to be influenced positively by, the fact and reminded that our patients also know, their bodies and what it is that they think is best for them as well. And I'm so glad that that worked out as positively as it did. So thank you so much for sharing that. As we wrap up our conversation, I just want to, ask, Dorian, is there any other, advice or anything else that we haven't discussed that you think is really important for, a student or an early, careerist to be able to start, thinking about as they're moving toward their journey of being a healthcare professional?
Yeah, Brianna, as I summarize sort of in my mind what are the key high points, and some of these I did sort of mention earlier, but just for me, I think it's important to think about the people around you. Um, and that's probably one of the most important things is like making sure that you have this support. And like we mentioned, it might change over the years, but really having your, as you call it, board of directors engaged and making sure those people know that they're on your board of directors. That's really crucial, that they know that they're a source of support for you. People are a lot more likely to answer the phone or answer your text, even in their busy, crazy lives, if they know that you're relying on them. And hopefully they can rely on you to be the same, or you're on someone else's board of directors. So that I think is crucial. Remembering that most healthcare professions do carry with them a pretty long path and it can be very challenging. And not being afraid if you're going along that path and you're realizing, I thought I wanted to go into dentistry, but really it doesn't seem like from my experiences that it's what I want to do. Don't be afraid to change that path. It may be that you thought you liked dentistry, but then you did a bunch of rotations and you're like, not really for me. Maybe I'm interested in veterinary medicine or I want to become an RN or whatever the case may be. Don't be afraid to change. Don't get stuck in a path that's not for you. Um, I'd probably say keeping the big picture in mind and just remembering that the journey is long and it also can be overwhelming if you try to think about and do everything all at once. So sort of thinking of it in piecemeal fashion helps to make it a lot more palatable and a lot more doable. And I think that would be the big highlights.
That is wonderful. Thank you so much. And I'm realizing that there was one thing that you and I in our conversations have talked about a lot, but we hadn't really talked about here. And I just wanted to ask just one more question and think we'll be able to wrap up. But it's about your like your values and your why. Can you say just real quickly about where does that come into play when we think about like, not just like the pros and the cons, but like your value system or your why for getting into healthcare in the first place?
Yeah, absolutely. Yeah, we have actually, and I think um we have discussed that. I think it is important because the why is what motivates the whole journey. It motivates the whole path. It's what keeps you going. It's what when things get real and you're like struggling a little bit, because that's bound to happen at some point. It's what makes you keep pushing forward. And the value system, it's going to be a bit different for everyone. For me, I was strongly motivated by experiences I had with my grandparents' death. I was really close to both of them. They both died of cancer, very close to each other. And I lived right next door to them, so I was helping take care of them. I helped take care of them when they were in home hospice. And at a young age, I was early in high school when I was doing that, and that really motivated me. It was powerful, and it was a powerful experience that motivated me to keep moving. And for me, that really was the bulk of my why was, being able to help on that level other people. I really, really, and I considered nursing at one point because of that. Because my aunt was a nurse and she was taking care of them. My grandfather who passed was a nurse. So I had a lot of nurses in my family who were close, who were sort of advocates for that career path. But I decided to become a doctor. Um, But yeah, I mean, having a strong why is really important, and that'll be different for different people. And for some people, it might be because I want the financial security in addition to helping people. I want to be financially secure because I want my family to be okay. I want my kids to be okay. As I said earlier, it's okay to have that be part of the motivation. I don't know that that's a strong enough soul motivation, but I think that it's important to understand your why. And find it before you embark on that path.
That's so great. Thank you so much for sharing. Well, Dorian, this has been a really enlightening conversation. I'm so glad that we have the opportunity just to learn from you and to hear some great stories and some wonderful advice. And so we just wish you well as you continue to, navigate being, a great professional in your field and a mom of some young kiddos, it sounds like. And just wish that you have a great afternoon and look forward to chatting with you again soon.
Thank you so much, Brianna. I appreciate it. You too.
Thank you.